Ladies and gentlemen, welcome to today's program, Getting Your Patient on the Path, an overview of Stanford DSMP in Michigan. Our speakers today are Mark Lausch and Andrea Lawhoff. Mr. Lausch, you may begin.
Thanks so much. Good afternoon, everyone, on this fine spring day in Michigan. And today we're going to talk about getting your patients on the path, which is an overview of Stanford DSMP in Michigan. This is presented by the Lake Superior Quality Innovation Network. The Lake Superior QIN is comprised of three organizations, MPRO in Michigan, Metastar in Wisconsin, and Stratus Health in Minnesota, in support of the Centers for Medicare and Medicaid Services, providing healthcare quality improvement in each organization's respective state. Today's webinar slides will be available on the Lake Superior QIN YouTube page within the next week, and Andrea will also mention that in her closing comments. At the end of the presentation today, there will be an evaluation that we would like all participants to complete in order to provide us feedback on how we did and how we can improve our work in the future. We really greatly appreciate your feedback and comments on the evaluation. It really does help us identify where we can do better work and how we can improve these presentations. So if you could stay on for a minute. The evaluation should pop on when we start doing the Q&A at the end. If you could please complete that, we would greatly appreciate that. So let's begin our presentation. Andrea's going to flip the slide here. There we go. Our objectives today, as you can read, we want you to be able to identify evidence-based programs and how they benefit patients. We're going to discuss the PATH programs in Michigan. You're going to hear some testimonials from past participants who have attended diabetes PATH workshops. Those are the workshops that we do here at MPRO. And you're going to learn how PATH can benefit your patients in the management of their chronic conditions. And finally, learn how you and your organization can get more involved in the PATH program. Just for the record, though, PATH stands for Personal Action Toward Health, although I probably believe I'm speaking to the converted already, so most of you probably know what that means. Okay, next slide, please. Thank you. So what are evidence-based programs? Or EPBs, or EBPs, excuse me. As the slide states, they're programs that are based on research. Data is collected from research studies that demonstrate that an intervention or program has been successful with a target population and then tried out in real-world settings. An evidence-based program is one that has been demonstrated to be effective with the target audience. If it has been demonstrated to be effective, then the intervention can be disseminated in the real world as an evidence-based program. There are clear protocols for training and conduct of the program so these community programs can maintain fidelity and to be successful. So fidelity is the degree of exactness with which something is copied or reproduced. So in evidence-based programs like PATH, fidelity means that the program is executed in the same way each time it is presented and applied over time. Fidelity is very important in PATH programs because these programs are replicated by many different people across many different settings. So we have healthcare professionals that do PATH programs. We have lay leaders that do the PATH programs across the state. So it is vital that the same messages and materials be communicated consistently over time and place. Next slide, please. So, what evidence do we need? In order to demonstrate evidence-based programs like PATH, there needs to be a demonstrated need. The first is development of evidence-based programs begin by demonstration of need or evidence that a health problem exists. So typically, epidemiological studies and data that demonstrate the prevalence and need of a program are collected. Research studies are then conducted demonstrating the efficacy of a program or intervention's ability to improve health outcomes. So in this case, the PATH program was tested and tried on different groups of people, persons with diabetes, and it was shown to be effective in improving health outcomes. And then finally, these studies also demonstrate the relevance in the community or target population. The program's attractiveness, or the desire of the target audience to participate in the program, and that the program addresses the condition in which it was designed to impact. So we have evidence that a health issue exists, evidence that it is effective, and that evidence about design, context, and the attractiveness of the program all come together in the development of evidence-based programs. Next slide, please. Thank you. What are the advantages of evidence-based programs? There are many reasons why evidence-based programs such as PATH are meaningful and valuable to patients in the community at large. Improvements in the health and well-being of older adults through participation can positively impact the individual, their families, and caregivers, as well as the community in which they live. They can entice new participants into the program or in an intervention if that's what you're trying to prove by word-of-mouth recommendations. Strong evidence-based programs like PATH can attract funding sources that could support sustainability. And finally, they can provide a basis for partnerships between other organizations, including healthcare providers, community-based organizations such as the area agencies on aging, and organizations like MPRO. It's very interesting that MPRO has partnered with the Michigan Department of Health and Human Services, with the area agencies on aging, to promote and help provide these PATH classes to communities and seniors all across Michigan. So that's the example of the partnerships that can be formed to promote these types of programs over time. Next slide, please. Evidence-based programs have demonstrated outcomes. As you can see on the slide, the potential positive outcomes associated with evidence-based programs are multifaceted. These programs can improve participants' quality of life. They can improve mobility, independence, reduce pain, improve balance, help develop self-management skills. Evidence-based programs can reduce the impact of disability by delaying onset of complications, reducing falls, improving nutrition and physical activities, improving awareness of nutrition is a big one in diabetes path. Many participants learn how to read food labels for the first time or really look at them for the first time. So these definitely can help reduce the impact of the disability. Improved mental health can be seen in participants by increased ability to self-management, increased self-efficacy, the connections they make with other older adults and participants in the program. It can be shown that their outlook on life is improved because of their ability to better self-manage their chronic conditions. And finally, evidence-based programs do lower healthcare costs by decreasing visits to the emergency department, by reducing hospital admissions and readmissions. Next slide. So, personal action toward health is evidence-based, and that whether that's the chronic disease path or the diabetes path, it has been found to benefit the target population of older adults with diabetes and other chronic conditions. It has been demonstrated to show a decrease in overall healthcare costs with those who compared to those who complete a PATH workshop to those who don't. It certainly causes no harm to participants, and it does not waste valuable resources and meets the goals of the Health and Human Services triple aim, which is lowered costs, improved care, and population health. And I'm sure we're all familiar with those and have heard those many, many, many times. Next slide, please. So, the quote here, people with chronic conditions rarely spend more than 1% of their life at a healthcare facility. So, the other 99%, they live their lives, whether they're at home, in an assisted living, in a nursing home, whatever. They're wherever they call home. And so as we read this statement, all of us know how true this is, that persons with diabetes and other chronic conditions spend the majority of their time in self-management of their diseases. They go to their doctor's office and they spend a little bit of time there, they get some instruction there, but the majority of the care that they have or that they provide to themselves is through self-management of their diseases. They interact with family, friends, caregivers, or spend time alone. So by developing consistent and evidence-based self-management skills, persons with chronic conditions can maintain their health, reduce and avoid complications, and lead the lifestyle they wish. I think that's a real important concept, is that they lead the lifestyle that they wish, whatever that is, that they're able to take ownership of that and participate in the activities and the functions and have the relationships that they want. So proactive self-management can be an important determinant in a person's ability to live longer and be more healthful. Slide, please. So how does evidence-based programs like PATH benefit patients? So PATH programs benefit participants in a myriad of ways, They help persons with diabetes and other chronic conditions learn to make wiser choices, healthier decisions, and become more mindful of their disease state and their ability to be self-managers. We see that a lot in the classes that we teach about this mindfulness. I mean, that's kind of a catchword now, but I think that that's really important, that a lot of the seniors that I know that I personally touch in the programs that I teach, the diabetes PATH programs that I teach, I see them develop a mindfulness that was not there prior to their participation in the program, which I think is a very beautiful thing, that they start seeing things around them that they had not seen before, and that what they see is they sometimes view it in a different way, which allows them to be more mindful of taking care of themselves, of making healthier choices in eating, exercise, and nutrition, and things like that. And by becoming more mindful of their disease, they become better self-managers. The workshops also reinforce the importance of healthy choices by utilizing group reinforcement and peer modeling of healthy behaviors. Again, we see that a lot in the PATH workshop that we teach, and I'm sure happens in other PATH workshops too, is that those that may not have been active or may not have been mindful or cognizant of healthy eating habits see other people start doing things and they start to do it themselves. I can't tell you how many times we've done classes where they do action planning at the end, and somebody says they're going to start walking or doing more exercise, and many of the others then follow suit by saying they're going to do that, and they actually do follow through with that. So that they use that as the pure modeling and reinforcement of healthy behaviors and are able to integrate that into their lives. Many individuals may be unaware of the implications of their health choices and lead isolated lives. So PATH workshops expose them to self-management skills and techniques, as well as interactions with peers who are experiencing similar situations and conditions. The old "we're all in the same boat" kind of concept, that when they share stories and experiences with others who are going through the same thing that they are, trying to manage the same disease or other chronic conditions that they see this camaraderie and this connectedness with other participants. And these connections with others can be important tools in raising self-confidence and normalization of their views of their chronic conditions, which is really important. By helping normalize what they're going through, they then can feel more empowered and to take better care of themselves. Next slide, please. So some examples of evidence-based programs in Michigan, and these are Stanford University self-management programs. We have Personal Action Toward Health, the Chronic Disease Self-Management, or Living Well with Chronic Conditions. Diabetes PATH, so the Diabetes Self-Management Program, which Andrea and I participate in frequently. There's Chronic Pain Self-Management, and there's Tremando. And Tremando is a Spanish language version of the DPATH program. It is not a direct Spanish translation, rather a specialized curriculum that encompasses material specific to Latino. So it is not just a straight Spanish interpretation of the Stanford PATH, but a specialized program. So these are some of the Stanford University self-management programs in Michigan. And finally, I'm going to finish on talking a little bit about how self-management differs from patient education. So self-management allows a person with diabetes or other chronic conditions to better manage their lives while living with a chronic disease. Self-management assists participants in making better and mindful choices by learning how to problem solve and develop action plans. Action plans are really important in the DPath classes and other PATH classes by having them develop plans for the week to become more active or to do activities that they would like to do. Self-management definitely improves participants' confidence in their own ability to make changes in their lifestyle, and it increases the skill and confidence to be proactive self-managers. Patient education tends to be more focused on changing behaviors. The dissemination of technical skills and information, such as using a glucometer, how to read the results, how to do your blood sugar, all important, very important skills for someone with diabetes to learn. But that's more in the patient education realm of things. Patient education tends to provide disease-specific knowledge and teaches patients to use specific tools and techniques, such as care plans. Both of these models can be effective in teaching patients to better manage their chronic condition. While patient education is a more didactic in approach and utilizes healthcare professionals to provide the education, self-management is really geared toward assisting the participants to develop their own skills and potential to manage their condition, and, as I mentioned earlier, often utilizes peer or lay leaders to provide the materials. Very important. So I'd like to now turn the program over to Andrea Law, who will explain more about PATH programs. Andrea.
Thanks, Mark. So next I'm just going to provide you an overview of the different PATH programs available in Michigan that Mark already mentioned. The first one is the chronic disease PATH program. As Mark said, these were all developed by Stanford University's patient education program. And these programs are licensed, so what that means is an organization needs to purchase a license from Stanford to be able to host the workshops and to be able to have trained leaders. These workshops typically have 10 to 15 participants, and they last 6 weeks, and they're taught by 2 certified leaders. So the certified leaders, as Mark said, could be either lay leaders from the community, or they could be healthcare professionals, and they are trained for 4 days. And they must teach a workshop within the first year of their training to become certified. The workshops are structured as a participative instruction with peer support, and it's really designed to enhance the patient's medical treatment. So it really serves as a good source of group support outside of the medical office setting. And it is evidence-based, as Mark has said, so it has been tested and has demonstrated results within the community. So PATH encompasses, the goal of the workshop is to help participants become better self-managers. The workshop content isn't disease-specific, but it focuses on the symptoms that are common to people that have a variety of health conditions. So over the 6 weeks of the workshop, an emphasis is placed on creating personal action plans and setting practical or achievable goals. So PATH really encompasses working with your healthcare provider. Participants can learn strategies to help them deal with problems such as pain, fatigue, or difficult emotions. Other topics can include managing their health symptoms or managing their medication, relaxation, healthy eating, physical activity, and how they can better communicate their wants and needs with their family and friends. And it really serves as a holistic approach. So it takes a medical and a psychosocial component of their condition. So diabetes PATH is similar to chronic disease PATH, although there is more of an emphasis placed on how people with type 2 diabetes and their caregivers can manage the condition. So it is also a 6-week program for 2.5 hours a week. And subjects that are covered include techniques to deal with symptoms of diabetes, such as hyper or hypoglycemia, and how stress can affect their blood sugar levels, any emotional problems such as depression or anger or frustration, appropriate use of medications, and how to work effectively with healthcare providers. And again, in diabetes PATH, participants will make weekly action plans and share their experiences that they're having in between workshops each week. And they can also help each other solve problems that they encounter in creating their action plan and carrying out their self-management program. And again, it also requires 2 certified leaders to go through a 4-day training, or if they're already certified in a chronic disease program, they can do a 2-day cross-training if it's available. And then there's also the chronic pain path, and during this workshop, a variety of topics that are important to those who have chronic pain are covered. Again, goal setting is a really big one here. They talk about relaxation and nutrition, and also into problem solving. So again, requires 2 certified trained leaders and can do a cross-training if it's available. So although there are path workshops that cover various chronic conditions, many of the same topics are covered within the workshop, and I'm not going to go through all of these, but the curriculum on the slide on the screen right now shows a lot of the topics that are covered across the different path workshops. There are a few different techniques that are used in the PASS program, and it covers many things about chronic conditions and diabetes. So what your patients will really learn are ways to help take care of their health. There are different techniques used throughout the workshop to help patients become better self-managers. So the first is goal setting and action planning. So participants can learn to make weekly action plans to help them stay on track with their chronic disease or diabetes care. We also use feedback or problem solving, where workshop participants will help each other to learn and solve problems managing their chronic conditions. We also use decision making and also management tools. Participants are presented with a toolbox with a different self-management tools and techniques to manage their condition. So in that toolbox, we include healthy eating, working with their healthcare provider, physical activity. A lot of the topics I mentioned were covered across the different PASS workshops. So here is an overview of all the topics that are covered within the PASS workshop, and it shows you which week each topic is covered. And as you can see, there are topics that are covered every week, and that would be making an action plan, and also feedback and problem solving is covered almost every week. So the workshops change every week. You can see that there are different topics that are covered, but there's also that the same topics that can be covered, like making an action plan. There is a little bit of a difference in the overview of the diabetes self-management workshop, with an emphasis on preventing low blood sugar, monitoring blood sugar, and skin and foot care. So those are probably the major differences that you can see in the content covered in the diabetes self-management courses. And here we do talk about monitoring blood sugar throughout the 6-week workshop and making an action plan as well. So what are some keys to success? So the format addresses specific problems and goals for people with ongoing health problems. So it's not to serve as a drop-in support group. Participants are really encouraged to come to the entire 6-week session, because they do learn a lot of content within each workshop, and it's all very important that they don't just come to 1 or 2 sessions. That it's really important that they come to all of them if they can. The workshops are not prescriptive, so participants are able to choose what they want to work on and how to track their own progress towards their own self-management program. And the trained leaders can offer guidance and support, but participants can really find solutions from each other and hear what other problems that people are dealing with the same condition. We were going to show you a quick video here, but unfortunately that wasn't going to work, so I'm going to add the link to our YouTube video for this in the chat. It provides a great testimonial on what some of our participants in our classes and our workshops have had to say. It gives an overview of what diabetes PAP is, and then also we've interviewed a few of our participants, and they've gotten some really great feedback for us. So if you have a second, I would really encourage you to watch that video. It's really inspiring to hear what some of our participants have had to say. So we also have evidence that the PASS programs have worked. We've seen from our participants increased exercise. They've learned better ways to cope with their symptom management. They have better communication and a better relationship with their physicians and also with their families their friends and their caregivers. We've seen an improvement in their self-rated health, their disability, and their social and role activities and health distress. They typically have more energy to do the things that they actually want to do and have less fatigue. We've seen decreased disability and also fewer physician visits and hospitalization. So as part of the Diabetes PASS program, we are tracking pre- and post-workshop data, and we have some preliminary results that I have included on the screen. So the pre- and post survey assesses participants' knowledge and their progress in managing their diabetes. So these are just two examples of some of the questions that are asked on the pre- and post surveys, and as you can see, there are a pretty good percentage of those that have improved. So one of the questions that was asked was, do you feel you can make a plan with goals that will help you control your diabetes? And 32% improved and 60% maintained, which we view as good. And the other question was, in the last week, how many days did you exercise for at least 30 minutes? And 45% improved there. So these are some pretty great results that we're seeing from our Diabetes PASS program. And this graph groups together all questions that were posed on the pre- and post test into 3 different categories. And for this, improvement includes both those that have improved or that maintained. So 92% of our participants improved in the knowledge questions, 85% improved in their coping skills, and 69% had improved in the behavior questions. So again, we're seeing some really great and positive results from our pre- and post surveys that we're tracking on our participants. So next what I'm going to talk about is how your practice, if you are working at a physician office, how can you get involved with the PASS program. I've listed just a few ideas here for you. Some things that you could do would be to put up flyers about PASS in your lobby or in your exam rooms or at your reception desk. You could receive workshop updates from when there's new locations and workshops scheduled near your office. You could also utilize a patient portal to provide a list of upcoming local workshops to your patients so they have them readily available to them. Or you could refer patients directly. If you know of a workshop that's in your area, you can utilize our referral tab, which I will show you in a second. You can collect a sign-up sheet at your reception desk, or you can also send a letter to all of your patients who have diabetes. Some other ideas would be to have a PASS representative attend one of your staff meetings to answer any questions and to talk more about the PASS program. One big one that we would really like to encourage would be to even host a workshop at your practice, because your patients are already very comfortable with seeing you as a provider, and they might like just coming into your office to receive more education on how to manage their disease. You can also assist with recruiting to help get about 12 to 15 participants in a workshop. So what we would recommend you do for this would be to run a patient list of all your patients who have diabetes and send them that physician letter that I had mentioned of an upcoming workshop, and then setting up a time and date of a workshop. So you can also find more information on the PASS program at My Healthy Program. That's MI, healthyprograms.org. It provides a really great overview of all of the PASS workshops that are available, and you could search for PASS workshops, whether you're looking for chronic disease, diabetes PASS, or chronic pain PASS. They're all available on there. And you can also look for leader trainings if you or any of your staff were interested in becoming trained as a leader in PASS. So again, it's a really great resource to learn more about the PASS program. This is the prescription pad that I had mentioned that is available from Empro. So it's designed to be used by all types of healthcare providers. It could be doctors, nurses, MAs, anyone across the board. So on the front of our prescription pad is the prescription to refer people with diabetes to a specific workshop in the area. And the back side shows easy to understand information about diabetes and how it affects a person's entire body. So it also provides tips to help manage diabetes and prevent complications. So if you were interested in receiving any copies of these prescription pads, I can put my contact information in the chat. This is just a list of all of the current license holders within the state of Michigan that are doing PATH programs. So if you were interested, please feel free to reach out to any of these organizations. MPRO holds a license for diabetes PATH. So if you're interested in becoming a trained leader in diabetes PATH, please feel free to reach out to us. Right now, at this time, I think we will open it up for questions, but I just wanted to, again, mention that, as Mark said earlier, our slides from today will be available on our Lake Superior Quinn YouTube page within the next week. And at this time, we'll pull up the evaluation questions, and please take a moment to let us know how we did by filling these out. Operator, can we open the lines for Q&A?
Sure. Ladies and gentlemen, if you have a question, please press the number 1 on your touch-tone phone. If you have a question, please go ahead and press the number 1 on your telephone keypad. Please wait while we hold for questions.
Or if you have any questions you'd like to enter in the chat, please feel free to do that as well.
We don't have any questions at this time. Ladies and gentlemen, if you would like to ask a question by phone, please press the number 1 on your touch-tone phone.
And it looks like the evaluation has just popped up onto the right of the screen, so if you could take a minute to do that, we greatly appreciate that. And we also hope that you've enjoyed today's webinar and learned a little bit more about evidence-based programs and personal action toward health PATH workshops that are available in Michigan. And we really encourage you to get your patients on the path.
I've also added my contact information to the chat box if you would like to have some more information on how to set up a PATH class, or you would like to get involved a little more. Please feel free to email me. My email is in the chat.
I'm showing no questions on the phone at this time.
Okay, as people finish the evaluation, just wanted to let you guys know that that Andrea and I are going to be offering a leader training here at MPRO in Farmington Hills, and the dates for that are going to be July 12th, 14th, 19th, and 21st of July, and they're going to be typically, I think it's 8:30 to 4, and by completing those 4 sessions, you could be a leader to do diabetes PATH in your agency or community. So again, that would be July 12th and 14th, 19th, and 21st. It's free of charge. Contact Andrea, and we can sign you up for that if you're interested. We do have space available, and we're going to be doing it at our Farmington Hills location. So please, if you're interested, contact us. And I think if we don't have any remaining questions, we can send you guys off to an early lunch then, if you're not eating already.
I am showing no questions at this time.
Okay. So thank you all very much for your attendance at our webinar today, our presentation today, and we hope to talk to you again real soon. Have a great afternoon.